Trauma Nursing Care Course. Cold Application. The application of cold constricts blood vessels, inhibits local circulation, suppuration, and tissue metabolism, relieves vascular congestion, slows bacterial activity in infections, affects or reduces core body temperature, and may act as temporary anesthesia during brief painful procedures. Cold helps decrease edema by decreasing capillary permeability and causing vasoconstriction. Because treatment with cold also relieves inflammation, reduces edema, and slows bleeding, it may provide effective initial treatment after eye injuries, strains, sprains, bruises, muscle spasms, and burns. Studies show that local cold application can also significantly reduce labor pain during the first and second phases. Cold therapy, also called cryotherapy, typically helps relieve pain after certain surgical procedures, including arthroscopy and total joint replacement. Cold may be applied in dry or moist forms, but cold therapy devices shouldn't be placed directly on a resident's skin because doing so can damage the tissue. Moist application is more penetrating than dry application because moisture facilitates conduction. Devices for applying dry cold include an ice bag or collar, a cold therapy system, chemical cold packs, and ice packs. Devices for applying moist cold include cold compresses for small body areas and cold packs for large areas. Because cold treatments cause vasoconstriction, they should be used cautiously in patients with impaired circulation or high blood pressure and in patients with an area of diminished sensation, such as a patient who has been treated with local anesthesia. In addition, application of a cold therapy device should not occur on an open wound. Reducing pain with ice massage. Direct application of ice to a patient's skin is normally contraindicated because it can damage the skin surface and underlying tissues. However, when carefully performed, this technique called ice massage can help patients tolerate brief painful procedures such as bone marrow aspiration, catheterization, chest tube removal, injection into a joint, lumbar puncture, and suture removal. It can also be used to treat sore muscles such as neck and lower back pain. Ice massage is most effective if applied within 48 hours of an injury. It reduces inflammation from the injury and slows nerve impulses, reducing pain. The goal of ice massage is to achieve numbness to the area without injuring the skin. Prepare for ice massage by gathering ice, a porous covering to hold it in if desired, and a cloth for wiping water from the patient as the ice melts. One option is to freeze water in a paper cup ahead of time and then remove the paper from half of the cup, exposing the ice for use for the procedure. Just before the procedure begins, rub the ice over the appropriate area in a circular motion to numb it. Assess the site frequently and stop rubbing immediately if you detect signs of tissue intolerance. As the procedure begins, rub the ice over a point near but not at the site. This action distracts the patient from the procedure itself and gives another stimulus in which to concentrate. Limit ice application in one area to about 5 minutes and assess the skin frequently for damage. If the procedure lasts longer than 5 minutes or if you think that tissue damage may occur, move the ice to a different site and continue massaging. If you know in advance that the procedure will probably last longer than 5 minutes, massage the site intermittently. 2 minutes of massage alternating with a rest period until the skin regains its normal color. Alternatively, divide the area into several sites and apply ice to each one for several minutes at a time. Equipment: vital signs monitoring equipment, towel, optional, gloves, dressings. For an ice bag or collar, cold tap water, crushed ice, insulation barrier or cloth covering, and tape or roller gauze. For a cold therapy system, cooler control unit with tubing, differs by manufacturer, water, cubed or chopped ice, appropriate cooling pad, water supply cord, insulation barrier or cloth. For a chemical cold pack, single-use packs for applying dry cold, insulation barrier or cloth cover, and tape or roller gauze. For a cold compress or pack, basin of ice chips, container of tap water, bath thermometer, compress material, 4 by 4 gauze pads or washcloths or pack material, towels or flannel, fluid impermeable pad, waterproof covering, tape or roller gauze. Preparation of equipment. Inspect all equipment and supplies. If a product is expired, is defective, or has compromised integrity, remove it from patient use, label it as expired or defective, and report the expiration or defect as directed by your facility. Ice bag or color. Select a device of the correct size, fill it with cold tap water, and check for leaks. Then empty the device and fill it about halfway with crushed ice. Using small pieces of ice helps the device mold to the patient's body. Squeeze the device to expel air that may reduce conduction. Fasten the cap and wipe any moisture from the outside of the device. Wrap the bag or collar in a cloth covering and secure the cover with tape or roller gauze. The protective covering prevents tissue trauma and absorbs condensation. Cold therapy system. Remove the cooler control unit lid and fill with water to the indicated fill line. Then add cubed or chopped ice to the indicated fill line. Replace and lock the lid. Connect the power supply cord into the device and then into an electrical outlet. Attach the cooling pad to the cooler control unit. Chemical cold pack. Select a pack of appropriate size and follow the manufacturer's directions to strike, squeeze, or knead to activate the cold producing chemicals. Make sure that activation measures haven't broken the container. Wrap the pack in a cloth cover and secure the cover with tape or roller gauze if not using an insulation barrier. Store these packs frozen until use. After exterior disinfection, you can refreeze them and use them again. Cold compress or pack. Cool a container of tap water by placing it in a basin of ice or by adding ice to the water. Using a bath thermometer for guidance, adjust the water temperature to 59 degrees or 15 degrees Celsius or to the ordered temperature. Immerse the compressed material or packed material in the water. Implementation. Verify the practitioner's order as needed based on the reason and type of cold therapy. Gather and prepare the necessary equipment and supplies. Perform hand hygiene. Confirm the patient's identity using at least 2 patient identifiers. Provide privacy. Explain the procedure to the patient and family according to their individual communication and learning needs to increase their understanding, allay their fears, and enhance cooperation. Ensure a warm, draft-free room. Raise the bed to waist level before providing care to prevent caregiver back strain. Perform hand hygiene. Record the patient's vital signs including temperature, pulse, and respiration to serve as baseline for comparison. Perform hand hygiene. Put on gloves as needed to comply with standard precautions. Expose only the treatment site to avoid chilling the patient. Assess the condition of the injured or affected area and surrounding skin, including the neurovascular status and skin integrity. Apply an ice bag or collar cold therapy system or a chemical cold pack. Place an insulation barrier over the treatment site or a cloth cover over the cold therapy device as appropriate. Place the cold device on the treatment site and begin timing the application. Inspect the treatment site frequently for signs of tissue intolerance such as blanching, mottling, cyanosis, maceration, and blisters. Also, be alert for shivering and complaints of burning or numbness. If these signs or symptoms develop, discontinue treatment and notify the practitioner. Refill or replace the cold device as needed to maintain the correct temperature. Change the protective covering if it becomes wet. Remove the device after the prescribed treatment period. Patients with soft tissue injuries usually experience pain and swelling reduction within 10 minutes. Applying a cold compress or pack. Place a fluid impermeable pad under the site. Remove the compress or pack from the water and wring it out to prevent dripping. Apply the compress or pack to the treatment site and begin timing the application. Cover the compress or pack with a waterproof covering to provide insulation and keep the surrounding area dry. Secure the covering with tape or roller gauze to prevent it from slipping. Inspect the treatment site frequently for signs of tissue intolerance such as blanching, mottling, cyanosis, maceration, and blisters. Also, be alert for shivering and complaints of burning or numbness. If these signs or symptoms develop, discontinue treatment and notify the practitioner. Change the compress or pack as needed to maintain the correct temperature. Remove the device after the prescribed treatment period. Patients with soft tissue injuries experience pain and swelling reduction within 10 minutes. Completing the procedure. Dry the patient's skin with a towel and redress the treatment site according to the practitioner's orders. Position the patient comfortably. Assess the patient's vital signs including temperature, pulse, and respirations. Compare them with baseline measurements to determine the patient's tolerance of the procedure. Return the bed to the lowest position to prevent falls and maintain the patient's safety. Discard liquids and soiled materials in appropriate receptacles. If you repeat the treatment, clean and store the equipment out of reach in the patient's room. Discard used supplies in appropriate receptacles. Remove and discard your gloves if worn. Perform hand hygiene. Put on gloves and as needed other personal protective equipment. Clean and disinfect other reusable equipment according to the manufacturer's instructions to prevent the spread of infection. Remove and discard your gloves and if worn other personal protective equipment. Perform hand hygiene. Document the procedure. Special considerations. Avoid securing cooling device with pins because an accidental puncture could allow extremely cold fluids to leak out and burn the skin. If the patient is unconscious, anesthetized, neurologically or cognitively impaired or otherwise insensitive to cold, stay in the room throughout the treatment and check the treatment site frequently for complications. Patient teaching. Teach the patient how to apply cold for a muscle sprain at home, if appropriate. If ordered, instruct the patient and family on the use of a cold therapy system after an orthopedic procedure. Using cold for a muscle sprain, patient teaching. For each cold application to a sprained muscle, instruct the patient to obtain enough crushed ice to cover the painful area. Place it in a plastic bag and place the bag inside a pillowcase or large piece of cloth. For later applications, the patient may want to fill a paper cup with water, stand a tongue blade in the cup, and place it in the freezer. After the water freezes, the patient can peel the water off the ice and hold it with a protruding handle. If using this method, tell the patient to cover the area with a cloth first because applying ice directly to the skin can cause frostbite and cold shock. Instruct the patient to rub the ice over the painful area for the specified treatment time for not more than 20 minutes. Although ice eases pain in a joint that has begun to stiffen, the patient shouldn't let the analgesic effect encourage overuse of the joint. After 24 to 72 hours, when pain and swelling have subsided or cold no longer helps, the patient should switch to heat application as directed. Complications. Intense cold can cause frostbite and tissue damage. Documentation. Record the time, date, and duration of cold application, type of device used, ice bag or collar, cold therapy system, or chemical cold pack. Application site, temperature or temperature setting, the patient's temperature, pulse, respirations before and after application, treatment site skin appearance before, during, and after application, signs of complications, and the patient's tolerance of the treatment. Document teaching provided to the patient and family, their understanding of that teaching, and any need for follow-up teaching.